Hi, Dr. Hizon, here to talk about the review of systems when doing documentation on a chart. As a general disclaimer, please refer to your particular doctor, as this is a general course not intended to be medical treatment and your particular situation may vary. So the purpose of a review of system is used to elicit the medical history. It can cover specific organ systems with a focus upon the patient's subjective symptoms. It can identify conditions and assist with illness and condition diagnosis. So it's a systematic review. It goes through the systems of the body: constitutional systems, eyes, ears, nose, throat, cardiovascular, respiratory, gastrointestinal, genital, urinary, and more. It goes through musculoskeletal and tegumentary, which is skin, neurologic, psychiatric, endocrinologic, which is hormones, hematologic, lymphatic, which is blood, allergic or immunologic. So this is usually the review of systems done after the history of the present illness, the HPI. It assists in gathering information and begins with the constitutional symptoms. So the constitutional symptoms would be things such as, have you had any fever or chills, nausea or vomiting, any night sweats? I especially like to ask for weight loss or gain since the last visit, appetite changes, fatigue or changes in sleep pattern. And then you systematically go through how are your eyes. Do you have any vision loss, blurry vision, eye pain, or redness? The review of systems reminds the patient to be sure that they've talked about everything they want to talk about. Any problem with your ears, any discharge or pain, hearing or problems with loss of hearing, nasal discharge or sinus pressure. In the mouth, do they have a sore throat or lesions, bleeding gums, tooth pain, hoarse voice, or neck pain? Cardiologic, do they have chest pain, palpitations, leg swelling or leg pain? And respiratory, do they have a cough or wheeze? Are they snoring at night especially? Or do they have shortness of breath? Gastrointestinal would go through, do you have nausea, vomiting, diarrhea, constipation, bright red stool or black tarry stools? Stool incontinence, do you have problems with leakage or do you have abdominal pain? Genital urinary, which is more the bladder, do you have frequency, burning with urination, incomplete bladder emptying, blood in the urine, urinary incontinence, and pelvic pain or sexually transmitted disease exposure. Genital urinary in the men is testicular pain, swelling in the scrotum, or difficulty and or maintaining an erection. With women is when's their last menstrual period? Do they have heavy menstrual flows? Do they missed or irregular periods? Menstrual bleeding, vaginal discharge. Musculoskeletal, do you have muscle pain, bone pain, or joint pain? Integument or skin, any new rashes, skin itching, breast pain, nipple discharge, or hair loss. Neurologic, headaches, muscle weakness, changes in sensation, memory, seizures, or do they have dizziness? Psychiatric, any anxiety, sadness, irritability, insomnia, or suicidal thoughts or problems. Endocrinologic, this would be hormones. Do you have any heat or cold intolerance, excessive thirst, excessive hunger? Hematologic, how about easy bruising or bleeding, and any lymph node enlargement? Allergic, immunologic, do they have hives or environmental allergies, and have they had HIV exposure? So on the chief complaint, this will determine the specific system to review unless it is in the physical exam. Review of systems might look something like this, where we talk about the review of systems, constitutional symptoms, and then step through each one: skin, eyes, ears, nose, and throat, their respiratory, cardiovascular, genital urinary, or gastrointestinal, musculoskeletal, neurologic, endocrinologic, and allergy and immunologic. And this could be the phrase used negative except for documented in the history of the present illness. So remember, vital signs are vital in decision making. Along with the physical exam, this can be useful in helping with the diagnosis. Pearls and pitfalls: if there is a problem, be sure to get the corrected affected side. Be sure to document all previous injuries, and please ask your doctor if you have any questions about this. And in primary care, we always emphasize to make sure that you document the quality measures. So be sure to write clearly instead of using slang or poor grammar. Be sure the recordings have the precise description in the review of systems. Be mindful of the correct dates, times, and spellings of the names if you can. And as always, we appreciate all that you do, because while doctors save lives, medical informatics specialists save doctors. Thank you.